What kind of conditions do you feel prolotherapy would benefit?
Well, its primary use has been in the chronic pain, not so much the patient who has an acute injury. In other words, they were 100% okay and then they have an accident and then they have an acute pain, because we know that most of those will get well by themselves anyway. But the people that we see are the ones that have had their pains for a year, 2 years, 5 years, 10 years, 15, 20 years. The long-term, chronic, intractable pain that hasn't responded to any other type of treatment.
Would you say that the majority of the patients that you've seen, the 8,000 or more patients that you've seen, really have had care by multiple clinicians and practitioners as well as multiple treatments prior to seeing you?
Yes, most of the patients that I see, I don't get the first crack at them. I usually get them after they've seen multiple doctors, and many of them having had multiple operations and multiple x-rays and MRIs and scans and thousands of dollars worth of diagnostic treatment without any appreciable benefit.
You, in the book that you wrote on prolotherapy, you had a section on an entity called Barre-Lieou syndrome. Could you explain what that is?
It was described independently by a Frenchman named Barre. It's the same Barre that had that Barre-Lieou syndrome and all that, and a Chinese by the name of Lieou. And writing independently, they both described this group of symptoms, which included such things as blurred vision, loss of balance, loss of the ability to concentrate, ringing in the ears, head, neck, and face pain, and dizziness that had no explanation, and there were just many things like that. And they at that time attempted to treat it with various forms of physical medicine with certain amount of help to them, but never able to cure these people. Well, then about the same time as the Prolotherapy group was getting started, there was an orthopedic surgeon by the name of Daniel Kafetz who took an interest in this thing, and he began to treat these cases by going over the head and neck and shoulder, and then got a group of statistics together and showed that they were able to give a great deal of relief to this Barre-Lieou syndrome. And I became more and more interested in it and had so many patients, and I had some very, very severely ill patients. Like I had a woman who was the wife of a pharmacist. She had 7 kids, and she was so dizzy she couldn't work, she couldn't take care of her house. She went to Northwestern University to their dizzy clinic, and they couldn't help her. And she was having an awful time. And she came to me, and I treated her, and she had 100% relief of her dizziness. Then I had a plastic surgeon from Grand Rapids who had developed this dizziness and loss of balance, and he got so he couldn't operate anymore. Well, you can imagine how far a plastic surgeon could get if he was dizzy and a little off balance. So he came to me and we treated him, and again he had 100% relief of pain and wrote me a very nice letter later on thanking me because he was now able to get back into surgery again. So it's a real set of symptoms, and it has a real cause, and the cause is treatable, and so we have had great success in helping many of these people, actually giving them a whole new life because so many of them just weren't able to function anymore.
How is there a relationship between ligaments and migraine headaches?
Well, of course, migraine headache is a thing that sometimes requires definition. Some people will say this, they have an ordinary headache and they say, yes, I have a headache. Then if they have a real bad headache, then they say, I got a migraine headache. Well, that isn't true most of the time. A migraine headache is a very specific kind of headache, and it comes in certain types of persons, and it has a very characteristic history. However, most migraine people, when you examine them, they'll have very definite findings in the ligaments of the head and neck and shoulders many times. And when we treat these things and relieve them of that pain, their migraine either becomes less or sometimes will completely disappear because it is this chronic pain that keeps triggering the migraine. So if you remove the triggers, then the migraine improves. And we've had excellent success with a lot of migraine patients.
Some chronic painful conditions, it seems, are real difficult to treat. And you've probably heard of TMJ syndrome. Is that something that prolotherapy can help?
Yeah, so TMJ is one of the things you like to see because you can cure almost 100% of them, and it doesn't usually take more than 1 or 2 treatments to do it.
What about people who have osteoporosis?
Osteoporosis, of course, is primarily a disease of elderly women, and if they come in and they have pain, you will treat their pain the same as you would anybody else, but you also encourage them to get on what available treatment there is for osteoporosis, which is moderate exercise, calcium, and estrogens.
If someone's had a fracture from osteoporosis, can prolotherapy help that?
It'll help the fracture heal and reduce the pain of the fracture.
And also, you know that people have heel spurs that seem to keep causing them pain. Can prolotherapy help that condition?
Most heel spurs are things that they found on X-ray, and it's what we call a red herring. The heel spur has probably been there for years and years and years, and most of the time the pain has been within the last year. The X-ray evidence of a heel spur does not mean that that's where the pain is coming from. And when you palpate the patient and the heel, you usually can locate the tender areas, and by injecting those, almost 100% of those cases get cured. Fibromyalgia, fibromyositis, myositis, fibralgia, all those various terms, in my opinion, are diagnoses, again, that people make when they don't know what's wrong with the patient. And the answer is yes, most of those will respond to prolotherapy.
How often do the people have to come back for more injections?
Well, in general, the human body takes about 6 weeks to heal anything. If you have a broken bone, 6 weeks. If you have an incision, it's 6 weeks. And almost anything you do, we figure about 6 weeks. So when we inject the back, we figure it's going to take 6 weeks to get the full benefit of what we've done. And so in general, we repeat the treatments at 6-week intervals.
How many treatments does the average person need?
Well, there's a percentage of the people, maybe 20% of them, will get well with one treatment. And another 20% will maybe take 2 or 3 treatments. And then there's always the tough ones that may take 5 or 6, or I've had some where we've given them 10, 12 treatments over a period of time before getting full recovery.
Can you give an estimate on the average patient, how many treatments they would need?
Well, I suppose the average would maybe be 3 or 4.